In some ways, they're a lot the same. They're usually round implants. They have a silicone shell. They're made a little bit differently. But inside the implant is what's different. The Saline has, of course, salt water in it, and silicone has more of a gel as compared to the shell that surrounds the implant. They feel a little different. Maybe that's the biggest difference to patients, is the silicone implant tends to feel softer and more natural compared to saline. I think short term that a saline implant can look excellent and almost as good as silicone implants in many patients. I think over time though, saline is heavier, it tends to weigh the breast down and will tend to round out and maybe even bottom out over time. I think in long term, the silicone implants tend to do much better. The biggest myth I hear about silicone implants is that they have to be changed every 10 years, and that's surely not true. I think that many silicone implants will last well beyond 10 years, 15, 20 years or more. So I think it just takes a continual evaluation with the plastic surgeon on a somewhat regular basis to sort of evaluate how the implant's doing. You know, if the implant changes shape and gets harder or gets rounder, maybe gets smaller, or maybe just a routine mammogram or ultrasound notices something that concerns them about the implant, then maybe you take a look and decide. But you don't routinely change your implants like you're changing your tires. Another myth that I hear about silicone implants are that they somehow aren't as safe as saline implants, and that's just clearly not true. I think from a safety standpoint, you can think of these implants as being very equal. They've heard a lot over the years about the safety concerns over silicone implants. But often we're talking about implants that were placed many years ago, what we call third generation silicone implants. Today we're already up to fifth generation implants, so we're talking about different implants in many ways. So we spend some time with our patients actually discussing the difference between what they may think about and what are the realities of silicone implants today. The silicone implants are definitely more expensive, maybe 50% to 100% more. So it could be significant, maybe $500 to $1,000 more for that augmentation. But I think that extra price or that extra cost can be well justified if you have a patient who has a more pleasing result or a result that lasts longer. So it's just sort of an investment in the future. And I describe it to my patients exactly that way. We're investing a little bit now to help you over a long period of time.